The opioid crisis is an ongoing epidemic, one of which is killing roughly 130 people a day. Upon discovering these facts, I was shocked, so I wanted to know more, specifically how the epidemic has had an impact within my community. So I spoke with professionals in opioid prevention, as well as first responders to gain insight on exactly what is being done and how they work together in the community.
So we're more familiar with the Chatham County, Liberty County, very reserved area. I'm not that familiar with the area further south, but I can say in our area, Chatham County had one of the highest overdose rates in the state. We were just behind the cities of Atlanta. That area had a much higher rate than ours. But the rate has leveled off. In 2018, we were the fifth highest area in the coastal area, in the state of Georgia actually, and the highest in the coastal area in Chatham County.
It's similar to the rest of the state and the country. I feel like the opioid epidemic has heavily impacted everybody in all of our communities. When you look at some of the data that's coming out through the Department of Public Health, Chatham County is pretty high up in overdose rates on a regular basis each quarter. In Bryan County, we have a very high prescribing rate. So I think, when you're looking at it, it might be maybe, not quite as bad as the heroin triangle in Atlanta, but at the same time, it's absolutely impacting us on a regular basis in all of our communities in the coastal region. The other thing that really impacts us is the 95 running through our communities, and of course the 95 is a pathway for all types of different drugs to come from the south throughout to the north and vice versa. So that always makes an impact, having the interstate come through and increases the likelihood of drugs, including opioids, to get into our communities.
It's very difficult to give you an exact number because a lot of the emergencies we go to, the signs and symptoms that the patient shows isn't necessarily indicative of only an opiate addiction, to be honest with you. But I can tell you from a perspective of the state of Georgia, the incidence involving opiates and drugs as in general has been on a rise tremendously the last 2 to 3 years. We've seen our number of confirmed opiate cases here jump. To be honest with you though, over the course of 2018, the numbers actually decreased slightly at the end of the year, which was a good thing. We'd like to believe that it has a lot to do with the prevention and other measures we've taken to help the community try to reduce the number of incidents we have here in Bryan County.
Every scene that we go to, we are always wearing gloves and having protection, handling any medication or coming in contact with people. We make sure that we're protected and have isolation from other people. We work very close with law enforcement and EMS, and at that level, we work closely with them. As far as social workers and stuff like that, we've just started this process, and in that we've learned a lot and what we need to do and what we can help and different avenues to help people.
We work tremendously close with all the partners, whether it be Richmond Hill Police Department, Bryan County Sheriff's Office, Bryan County Opiate Prevention Group. To be honest with you, it's going to be a team effort, and it's something that we take very seriously here in the county and the city. We work as a group. We're trying to start several programs, including the Safe Station program here in Richmond Hill. We have an opiate prevention committee that meets once every 4 to 5 weeks. So it's definitely a project that's going to take all agencies working together, and that's certainly happening here in Bryan County.
It's growing. It's I would say probably within the last, at least for as far as we've been using Narcan, it's actually a good measuring stick to see where we're at as far as opioid presence in Chatham County and the city of Savannah. I've noticed a significant increase over the last 3 years since we've used it. In 2016, we had 9 uses of Narcan, 9 documented uses by our officers. The following year, we had 19. So that's an increase by 10. And then this last year we had 23, so that was an increase by 5. This year right now, based on the last data I've seen, we've only used 2 this year, but we're only 3 months into the year. So time will tell as far as the end of the year, if our concern should be growing or should be staying the same or should be maybe pulled back a little bit.
So if I'm dispatched to an overdose or a possible overdose, it's not known until we get there. So once you get there and you assess the situation, if you have a witness on scene that knows that they're a known drug abuser, you're going to check to see if they're responsive, pulse, breathing. If they're foaming at the mouth, I see that a lot. And then at that point, if I feel that it's an actual overdose, then Narcan will be administered. My Narcan's always in my bag. It's always in the same spot. I don't have to look. I know I can reach over. I can grab my first aid kit, which is Velcro right inside my bag. I know that I have gloves in there. I have tourniquets. I have my Narcan and anything else that I might possibly need until EMS gets there.
Because I collect the data for our department, I read a lot of the reports, in fact all of them that involve Narcan use, at least on our part. I am commonly seeing within the last 2 years, heroin being the main opioid, although there are instances of Oxycontin, hydrocodone, other prescription medication, but the main drug of choice or use is heroin.
So they're both local collaborations as well as statewide collaborations. In our local area, we work closely with prevention, which is actually not in Chatham County but in Bryan County, but they come here to help us with collaborating. We also work with all of the clinics that prescribe methadone and Suboxone, as well as primary health care physicians who prescribe these medications and pain management organizations. We also work very closely with the local hospitals, because if it's not a collaborative effort between the local hospitals and whoever's providing the treatment, we will fail.
We collaborate with our local police departments, so law enforcement, our first responders, so our emergency services, our ambulances and things like that, people who come, they are oftentimes the people who are seeing overdoses and responding to those overdoses. We collaborate with pharmacies, we collaborate with doctors and prescribers, we work with service providers, so treatment providers, but also other community providers. We work with just community members who have been impacted within their family, so they might have a family members who are addicted. We work with the insurance companies. So we really try and hit every possible group of people in our community to help make a bigger impact.
One of the programs we've starting to implement called the Safe Station program. Safe Station program is a place where people who want somewhere to go to get on their road to recovery can come 24 hours per day, 7 days a week, and we will get them within touch with somebody who can help them. What happens in this program is somebody will come into our stations, we'll do a quick evaluation just to make sure it's not an emergency where we need to call an ambulance. We'll call a mobile crisis team who will come out and we'll get that patient where they need to go to start that road to recovery. It's a program that's worked in several other states, including Manchester, New Hampshire. They've seen tremendous success, and obviously prevention is our number one goal, so we want to do everything and anything we can do here in Richmond Hill to help people.
As I stated previously, the opioid crisis is an ongoing epidemic. It is an issue that should be addressed at a smaller scale before combating it at a national level. And as shown, community efforts have been made within the coastal Georgia region to ensure the demise of the epidemic. This is something that we should all be aware of. Though it may not seem like it, the epidemic has an effect on all of us as a community as well. But I think it's an issue that we can overcome. It just takes all of us to make it happen.